Kia ora. I am going to be talking a little bit about what to ask your care provider or your midwife, preferably before you book with them. Obviously, a lot of you will already have chosen a midwife or a care provider, so this can be a little bit difficult, but you can always change midwife or obstetrician at any point, even if you're going to have a baby in the next few days. It's entirely your choice, and it is your right to choose a care provider that feels good for you. So number one is asking them about their philosophy around childbirth and parenting. Some people find it more relevant to them to have someone with a more holistic outlook, and other people prefer a more medical background. Maybe your care provider focuses more on complicated or high risk people, or maybe they do more home births and feel more comfortable in that setting. Only you can decide what feels right for you. Number two is asking about appointments. So it's good to know where they are held, so the location in terms of where you live or where you work, how long these appointments are. So some midwives will only provide 15-minute appointments and it's quite quick. Others will spend 45 minutes or an hour with you, answering all the questions you might have and potentially building a bit more of a relationship with you. Also, it's good to know kind of what to expect in these appointments. Are they strict, or do they follow a schedule, or are they more guided by you? Number three, it can be helpful to ask how many women they book per month or how many birthing people they book per month. This can give you an indication as to how busy they might be, how tired they might be, or how stressed they might be. Generally speaking, the standard recommendation is 4 per month, but some people are more busy and some people are less busy. Number four, what is their backup or their practice situation like? So do they have many backups that they work with? Do they share the same philosophy? Will you get a chance to meet them? All of these things are really important for you to know. Also, it's really good to know how they work in terms of time off. So do they have every weekend off, every second weekend off? Are they week on, week off? Every midwife is different in how they practice. Number five, what are the non-negotiables when it comes to their practice? So every midwife is obliged to support an informed choice and informed decision making, so you are allowed to make the decisions that feel right for you. However, every midwife or healthcare provider has the ability to say that they're not comfortable with something, in terms of if something feels dangerous or unsafe for them, in which case they are obliged to offer somebody else to provide care for you. That could be finding you another midwife or potentially referring you to the hospital team, but it's slightly different in every region. So yes, it's important to know what her kind of parameters are, as every single midwife is different, as we've learned a few times already, in what they may or may not be comfortable with. Number six is, do they have an epidural certificate? So most hospitals will require that an epidural is staffed by an epidural certified midwife. Lots of midwives don't hold this certification because they provide less epidural cares throughout the year, and then they're not experienced enough to hold that certification. But others will provide lots of epidurals, therefore have the epidural certification. That's not necessarily a great thing, because sometimes that can be associated with higher intervention. However, only you can decide how important that is to you, and generally speaking, if you're planning to not have an epidural, then it's fine to book with someone who doesn't have an epidural certification, as if you get to the point where you need one, they'll probably be handing over to the core staff anyways. Number seven is, what are their statistics? So you may be interested in their normal vaginal birth statistics. You might be interested in their cesarean section rates. You might be interested in their NICU admission statistics. Only you can decide what feels important to you, but obviously every practitioner is going to have slightly different statistics depending on the way that they practice and the caseload that they take. And the last thing is around communication. So it's really important that you and your midwife or your obstetrician discuss communication boundaries. So when is it appropriate to text? When is it more appropriate to call? When is your midwife's phone on loud? When is it diverted to a backup midwife? It's all really important stuff to talk through just so that your partnership is really tight. So hopefully those things are helpful and you are able to take a few of these to your next appointment or to your meeting when you are booking with your midwife or care provider, and this helps you make a decision that feels right for you.